Okay then, it's quarter past. We're just gone quarter past 12. I'm going to make a start now. And first, thank you all for your time this afternoon. If could someone just give me a last thumbs up, just to ensure that you can hear me and I'm not actually just speaking to myself, that would be great. As I say, we've got a chat facility running this afternoon. Please feel free to leave any. Thank you for your thumbs up. Appreciate that. If anyone's got any questions, thoughts, comments, queries, anything else, please leave it in the chat. If I can't answer them during the session, I don't want to go over half an hour if I can help it, then I will certainly endeavour to get back to you at some stage. So we're going to actually get started now then. So this session is about improving staff and patient engagement. My name's Chris Elkin. I'm the Head of Healthcare here at Piota. I've been around the block a little bit, been 20 odd years now within the digital media industry. Spent 10 years of those working for a local NHS trust where I managed a lot of the online learning initially, so creating content for staff, mandatory training, essential to role, etc. Managed the website and the intranet whilst employed, and then latterly started to develop a bunch of apps around learning and revalidation. So yeah, I've got a good experience of the NHS and how it works, and some of the challenges, I think, in some instances, about trying to keep your colleagues, keep your patients kind of engaged in a quick and easy way. And that kind of alludes to that last sort of, paragraph there, or sentence, if you will. I'm really interested in the user experience, and it's something that we, as an organisation, thrive on, is trying to make these things easy. Removing that ability to having to think about it too much. I think if it's easy for people to engage with, easy to people to access, they're more likely to do it. The moment you have to think about something, then you're probably going to think about something else, and you've kind of lost the opportunity. So yeah, we're really interested in how we make these things easy for people. As an organisation, we've been around for about 5 years, probably the last sort of 2-3 years in the NHS space, but we're working with over 80 different teams now within the NHS, including NHS England, NHS Wales, a whole host of different regions up in Scotland, and lots of big trusts, teams, and departments within the NHS itself. We create a smartphone app solution, a platform, if you will, and all of our solutions look very similar. What I'm going to do is just show you a range of different apps that we've got. This one's a staff engagement app for a hospital up in the northwest. This is a patient app specifically aimed at youngsters coming in for surgery at NHS and Tayside. And as you'll see, I guess, onto our third app. All our apps look the same. Top half of the screen, we've got a logo and some branding, and the bottom half of the screen, we've got this 3x3 grid, which we refer to as our tiles, which is essentially a menu system. Each of those tiles have an icon and a label, and the idea is that as a user, whether that be a colleague, or whether it be a patient, or whether it be a parent, you can get your phone out at any time and kind of go onto the app and find the information that you need quickly and easily. It's not meant to be difficult. It's not meant to be challenging. It's not meant to be overly engineered or overly complicated. It's meant to be just quick and easy, so you can find that information. This is another one we've created, some guidelines for an organisation. So these are aimed at consultants and staff within a particular area, just wanting to make all of that information quickly accessible to people whenever they needed it, wherever they needed it. And again, other apps for the patient apps, or the staff apps. This one's for care homes, in the Black Country. So this one was produced to provide, at the start of the pandemic, all of the care home managers and all the care home staff with up-to-date information about the COVID, things they needed to look out for, training, resources that are available, the latest news, sent out to all of the staff, the care home managers, to really keep them abreast of everything that was happening in that quickly moving climate they found themselves in. Patient support apps. This one's a Macmillan information support app, and I'll look a little bit closer into that one. These are staff apps again. This one's aimed at porters and facility staff, domestics, etc. These guys don't necessarily have access to computers nor emails, never sort of seen the internet. All of their communication's been done verbally by their team leaders. So for the organisation to be able to reach out and have a direct contact with this, with this audience, guys that really were on the front line, was invaluable for them. But as you can see, different organisations, but the same app essentially. So increasing staff and wellbeing, this is what it's kind of all about, isn't it? And what we found through experience and through talking to our colleagues or partners out there in the NHS is that a lot of clinical staff just don't necessarily have direct access to the technologies, that can't access the internet quickly, that don't necessarily have access to their emails. It's just sometimes difficult in that clinical situation to be able to log onto a machine and have the time to be able to browse and find the sorts of information you want. So I really like this sort of image. It's in work's time, people are just, it's the hustle and bustle of the day, where really when you're talking about staff well-being, when you're talking about some of the training opportunities, all the sorts of good stuff that we're looking at, within the People's Promise to make sure that everyone's on an even keel, you don't necessarily have that option to do it during the day. So be able to get home and have a glass of wine or whatever, and just be able to sit and and just let that release valve off, and be able to pull out your device, pull out your phone, and have a little look at what's happening and what things are available to you, and what training you've got, or what different aspects of support are happening in the organisation is key. And I always think about one of the anecdotal bits of conversations we had with a trust we had in London, and they were talking about the London Eye had organised a competition for staff in recognition of all the hard work that they'd done. And I think it was a cocktail session where you could have cocktails and you could go around on the London Eye, have a great evening. But after the fact, lots of staff kind of had a bit of an uproar because they knew nothing about it. It was all on the intranet, but a lot of the staff didn't have access to the internet, so couldn't see that event, couldn't enter that competition. Didn't have the opportunity to really interact. So, being able to to be able to use your smartphone, which to be honest we've all got them these days. We're all kind of using them. Seemed a bit of a no-brainer for them, and we're seeing that more and more and more in different organisations where they're wanting to use phones as a way of contacting people, of engaging with people. And let's be honest, I mean, I work within the business. I'm staring at a computer screen all day. I've got a laptop here as well. But once I finish work, it's my phone. Everything I do is on my phone. Whether it's my banking, whether it's travel, whether it's the weather, whether it's looking at the football results or buying my shopping from Sainsbury's, it's all done on my phone these days. And that's the world that we live in. So it just kind of makes sense, I suppose, to be able to use these platforms to be able to reach out to your colleagues and to keep them in the loop, to provide the same opportunities and the same information that you do to potentially desk colleagues that do have direct access. An example of a staff wellbeing app that we've created for St Helena and Knowsley. This is their front page, and as I say, this is the menu there with the different icons representing the different bits of information that they're providing. So there's information there about mental health weeks, and lots of information there about well-being, about the different networks that are available to individuals to go and join and be aware of. Again, a lot of this stuff may or may not exist on the intranet, but for the comms team there to be able to use an app where everyone's got access to it just made perfect sense. And what we're not suggesting is is people reinvent the wheel and sort of duplicate information off one source onto another. But in some instances, it's just to use the app as a signpost or as a fingerboard. There's some great resources. They're just over there to go and find them. But as an end user, I'm confident in the knowledge that I can pull out my phone, I can go to the app, and it will deliver, or it will find me the information that I need, no matter where that is. Microsoft Teams, who would have Microsoft Teams a few years ago? But with different ways of people working, the team at STHK wanted to introduce the different technical platforms that are available. So if you were going to work from home, then we could give you access to Teams, and we could give you access to ESR, and we could give you access to whatever else it might be. But having all that in one place, so when I work as a end user, when I was moving around, whether I be at home or whether wherever I'm working, I can find all that information. It's all in one place. It's always with me. Information about benefits. So all of the information, you know, all the stuff that you naturally find in terms of you know, staff benefits and different things. Push notifications. I mean, this is, you know, a kind of a new communication phenomenon, isn't it? Really, we've all got our phones, we've all got our favourite apps on our home page. We've all got those little red circles with numbers in there, indicating there's some new information in there. And this is the same with our apps. You know, you can push out information, push out these push alerts or these notifications, and people will get a little, you know, a little update on the phone. Or if you've got, you know, a smart device, it might update you on your smart device. You know, for example, my watch comes up with little updates, but just kind of grabs your attention. Something's new. There's some new resources available. There's a new, you know, wellbeing session on this week. You know, surgeries closed this week. Whatever it might be, you know, you've got the ability to actually reach out and message people using, you know, using these smart devices. I particularly like this. Having worked for the NHS for a little while, I'm sure you guys are the same. You know, the staff survey comes around, you know, once a year, and it's, you know, it's quite an onerous task to kind of complete it. But what our friends at STHK wanted to do, St Helena Knowsley Trust, is create this thing called a pulse check, which I think is a fantastic idea, in where they, during the pandemic itself, at the start of the pandemic, was just send out a series of little questions, very, very focused, very targeted about particular areas, where they would get the responses from their colleagues. They could sort of analyse the responses, and if they started to identify problems or issues, they could get transformation leads in to go and have a little chat. So, you know, the sorts of questions were, you know, have you got the right PPE? You know, what's the leadership been like since, you know, during the pandemic? Is there anything else that you need in terms of, you know, resources, etc.? So just these little pulse checks, these little questions that were sent out with push notifications out to their colleagues, allowed them to gather that intelligence, gather that feedback, and then be able to go and action it. Which, you know, ordinarily, if they were doing that on via emails or, you know, on desktop computers, it may not have been as successful. Another one that we created fairly recently is an app for University Hospitals Derby and Burton, and this is specifically aimed at the facilities management and estate staff. So, as I say, your porters, your domestics, your security teams, again, you know, don't have the luxury of being able to sit behind a computer and get access to the intranet, didn't have an nhs.net email address once upon a time. So just very difficult, I guess, or very challenging, I should say, to be able to keep these people in the loop. So I think, you know, historically it would have been, you know, team leaders cascading information down to individuals, but this platform has really provided them with the ability to open up, you know, different channels in order that they can kind of engage directly with some of their colleagues. So again, you know, this is their app. With some of these apps, they would need to register first. So it's not like, you know, anybody can come and download it and start looking at the information. We've got a staff table within the system itself with the names of the colleagues and an email address and or telephone number, so we can authenticate them. When they first download the app, they must register, the system authenticates them, and then allows them to see the content on the app. So the information on this particular area, there's obviously lots of information about news. They want to keep them up to date with everything that's happening. Lots of, you know, good news stories out there, which again, you know, unless they'd heard it on the grapevine or, you know, had one of those water cooler moments, perhaps they kind of weren't aware of. So again, for the team there to be able to send this information out directly to their colleagues was, you know, invaluable. This is really good. I love this. So this is Neti, I should say, which is their intranet site, and they've been able to open up a little portal from our app directly into the Neti section. So again, although they may not have computers in their workplace, they may not have access to a desktop in the hospital, when they do get home, they can get out their phone and they can access the internet directly via the phone. So it's, you know, it really is just extending the reach of the technology into people's homes using you know, using smartphones, and the apps are, you know, a great way of being able to do that. I mentioned earlier, we're not all about, you know, reinventing the wheel or having data duplication in different places. You know, as and where we can, we just want to signpost or finger, you know, or sort of, you know, just divert people to this information. So yeah, this is really good, and I'm really excited by that one. Oops. So again, yeah, different systems. This is the My Learning Passport. So this is where all of the training, the mandatory training resides. It's their learning management system. So they can go in there and go and access. Again, might find it difficult, or I can't remember the name of it or how to access it when you kind of get home. But it's all here within the smartphone. Equal opportunities. We talk about the people's promise and making sure everyone's got the same opportunities within the organisation. We are, I keep saying we are the NHS. I still think I work there sometimes. But as the NHS, everyone has the same opportunity. So, whether it be training or whether it be, the scenario where there's different competitions or whatever it might be, different job roles that are available, make sure everyone's got the same access to it is kind of key in this world that we find ourselves in. So, just be able to give information about, different training things that are happening throughout the time, the different benefits that are available to people. I know not everyone knows about the blue light card and doesn't know, what local providers will honour it and what discounts you get. So again, these things are available to people, but a lot of folks just don't know anything about it because they don't have the opportunity to get behind the computers and find out. Lots of things about well-being. So, to ensure that they're in good physical and mental states as and when they can. Links to ESR, so all of the pay slips and different aspects can all be again accessed directly from their phone. So it is a bit, it comes back to that theory about this being a one-stop shop where everything's in one place. They can turn to their phone wherever they are, whenever they're ready, and just get all that information that they need as and when they require it. This one has got a contacts section within there. So again, they can press any of these buttons and it will take them straight through to that office or straight through to that team. Our system can navigate, different phone systems and, put the extension numbers and stuff in there. So again, you're not having to sit on the phone and waiting while the system asks you all the different options. You can program it such so it can go straight through and get you direct access, which again, people want. The minute it becomes a little bit complex and a little bit complicated and a bit long-winded, people stop doing it and you miss your opportunity. This one's a great little app that we've been partnering with the Dudley Group recently. Really like this app. The sponsor there has put some time and effort into creating this. But this is specifically for the emergency department team at the Dudley Group. And this app, again, with all of the other apps, you need to register before you can see any of this information. Whilst I'm sure none of the information is that sensitive, they just don't want the general public to be able to view it, and rightly so. So lots of information there about policies, procedures, standard operation procedures, whether they be at trust level or whether they be at team level. Again, clicking on any of these links will take you directly to those policies and procedures. Just makes it so easy for people to find. Any questions you've got about whatever it might be, you can pull out your phone and within 2 or 3 clicks, you've got that policy or procedure open. Lots of different guidelines. Again, these are guidelines created by the trust for the trust. Some of them may be national, but I think a lot of them are sort of localized. And individuals can come in at any time of the day, wherever they are, and come and pull up these pages and come and find the different aspects and the different the different guidelines and things that are available. Can't go into any more than this, but it's sort of almost self-explanatory. So teams there can go onto the rota and then go and visit the rota. Again, I think it's just a great way of using the app to be able to keep people up to date with everything that's happening. You can sit in the staff room, you can sit in the restaurant, you can sit on the bus going home, or sat in the traffic jam. Not that I say you should be looking at your phone whilst in traffic, but you've got that ability to be able to have a look at the rota wherever you are at any time. It's just really thinking about your audience, what they need, when they need it, and being able to put it on the phone. And that's the service we're providing. We're not subject matter experts. We don't know about all of your different aspects of your workplace or your teams, but we do have a solution that we can customize. We do have a solution that we can roll out very quickly and easily. That's that's fairly low risk, that allow you to really start engaging with your colleagues. Lots of different forms on here. I'm sure some of you guys will identify with some of these different forms. And again, you can pull out your form and you can do a handover sheet very quickly. You're not trying to get onto a computer, you're not trying to find it on the internet or wherever it might be. It's on your phone. You've pulled it out, you've sent it off, your job done. Whether that's handover sheets or request forms, whatever it might be, for your particular audience, just making people's lives easy, and that's what it's all about. Make people's lives easier. They can spend more time, I guess, more concentrated effort doing what they've signed up for, which is looking after folks, isn't it? So, yeah, a great way. This is a really good app, a really good example of what we've been doing and how we do it. Again, another directory list with details of the different folks that are in the teams. Information about training, colleges, links to different colleges and different things. So, all encompassing there. And there we go, some alerts as well. So there's a couple of examples there of staff engagement apps. But it's the same principle, really, about looking at the patient's experience and what sorts of information do they need and when do they need it. You guys, the NHS, they're your trusted advisors. You've got a condition, you're giving birth, whatever it might be. You're putting your health in the hands of your NHS partners. So to have an app from that team with lots of information about whatever it might be, the condition, the rehabilitation. In some instances, some of the apps we've created for children, sort of explaining the process. In fact, what can you expect, what you're going to see, who you're going to interact with. It's all about trying to provide that rich picture of everything that's happening or everything that you might need to do. But it's all localized. It's all localized information from your consultants or from your teams in there. This one's a cancer patient app. From East Lancs, again, same principle. It's the app. It's got its own logo and its own branding and its menu system here. And again, this is for cancer patients. The guys there identified. I'm sure we can all relate to it. When people are diagnosed, there's a hell of a lot of your mind's scrambled and you can't really take on any new information. So what they're suggesting is at that time they're informing the patients that we've got this app, all the information that you'll need about condition, about the support that's available, about what to do in certain scenarios will all be in this kind of one place. And you can share this with your support network, with your family, your friends, whoever it might be, so everyone's on the same page in terms of what you can kind of expect and what's available to help you through that time. So this one talks about personalised care. All of this content is created by the team at East Lancs. As I say, we're not content providers. We don't go away and write all this good stuff. We provide you with a platform. We provide you with the support and some expertise. But the content is produced locally by the teams. This one talks about the multidisciplinary team and what their different roles and responsibilities are. What to do if you're not feeling particularly well at a particular time. The different services that are available to people and how to access them. Excuse me. Information about financial aspects of the care, and so on and so forth. Again, contacts directory. They can go through to the different hospitals, the different teams, just making it super simple for people. Anyone's got a question at any time, they can pull out the phone, have a little look at it, and they can find the information they want. And this one's got a feedback form in there. So, in terms of friends and family sorts of scenarios, you can look to see what sorts of questions people are asking, or what sorts of information they need. Finally, then, in terms of the examples, one last more. I'm conscious of the time. This one's for our friends up at Morecambe Bay. This one's their Maternity Matters app. Same scenario again. Their logo, different tile set, different icons, different labels. But it's the information that new parents or grandparents or anybody else that's interested, for that matter, can go and have a little look at and be familiar with. So what you're doing, you just found out you're pregnant. There's the referral form there, almost straight away. There's embedded YouTube videos, so you can have like a virtual tour of the different birthing clinics that are available to you. All this information probably exists somewhere. I know especially when we look at YouTube. There's lots of YouTube videos that have been commissioned by teams, and they're on YouTube somewhere. And when we do these sort of demos, we start to integrate them in. Not many people have seen them, so it's just about, as I say before, it's trying to bring all that content and putting it all into one place. We're not always looking to replicate it or reinvent the wheel. We're just going to signpost people to it, because there's some great content out there. I think there's lots of great videos out there that are just underutilized because people just don't know that they exist. So yeah, these videos are all about different birthing clinics that you can go to, more guidance about various different aspects of pregnancy. Again, a contact section where anyone can just ring through to those different areas. Just press a button, it comes up with a number. You press the next button and you phone them through. It's super simple stuff. Push notifications, again, just letting people know about the different aspects of different things that are happening, keeping people up to date minute by minute if need be. So hopefully that's what's that, four different examples, a couple of staff engagement apps and a couple of patient engagement apps. But just quickly a little bit more about the solution before I sign off for today. Piota stands for Put It on the App. It is about just bringing all that information and putting it all together in one place, just making it accessible to people, whether that's colleagues or whether that's patients or whether that's families. Having that one stop shop, if you will, where I can just get my phone out and have a little look, and it's all there. So there's the information that we can put on there about resources, different videos, events calendars, links to different portals and apps, and so on and so forth. It's licensed on an annual basis, and I'll quickly just allude to that shortly. But I did say there's two aspects to it. So there is the phone itself, but then there's this content management system that you see on the left-hand side. It's a web-based system, super simple to use. I always kind of jest when we're doing training, and training only takes about 20 minutes, half an hour. But if you use PowerPoint or Word, for the last whatever, you're probably overly qualified, because that's all you're really doing. There's a nice little text editor. You put information in there, you put pictures in there, you embed videos, you create your different links, and then you publish it. A lot of these pages that you can see probably take a few minutes, to be able to create and to distribute, and it's super easy stuff. There's analytics engine in there as well, so you can start to see how many people have used it. You can start to see what categories that people are going into, so you kind of get a feel for how the app's being used. It really is really easy. I think for a lot of teams that we've worked with, and from experience, organisations want to sort of manage their, or teams want to manage their own content or manage their own app. Some of the teams that we work with have been out to IT and been out to comms and said, look, we want to do this or we want to do that. Well, we'll put you on the list with all the rest of the requests. So to have the ability to be able to do it yourself and to be able to do it relatively quickly and easily, it's been a bit of a godsend, I think, for a lot of teams that we work with. What does our process look like? So typically, we'll get an inquiry. You'll come to us after the event, hopefully, or give us a call or fill in a form on our internet pages, and we can get back in contact with you. We can have a quick chat. We can talk a little bit more about your ambitions and what you're wanting to achieve. I can show you other examples that other organisations have been kind of doing. And we span a whole host of different conditions now, and different engagement apps and different toolkits for different organisations. So, I've probably got a couple of examples for everything, well, for most things that people kind of come up to us with. But we'll have a quick chat, a quick Teams or Google's Hangout, just to be able to put a bit more, to give you a bit more information about our services. We tend to produce a free trial as well. Again, it's all about being quick and easy and making your life a little bit easier. So, if you come to us with an idea, with a thought, then we'll happily, create a trial for you, put your logo on there, create some of those tiles and icons that represent, what you're wanting to achieve, put a little bit of content behind the scenes, and that in itself then gives you a vehicle to be able to put that in front of your colleagues or front of patients or other teams that you might want to work with, that you can then talk about your vision. This is what we're trying to do, this is what we're trying to achieve, this is what it looks like, this is how it might work, and that in itself just helps to stimulate some conversations and just kind of moves that dialogue on a little bit. And again, it comes back to let's make it quick and easy. Let's try and remove the complexity out of this. you kind of can go away then and get your organisation, get an agreement, and raise the POs, and then we can get the project kicked off and give you training. I've got 8 hours elapsed there. I think the project, one of the projects we did, it took us about 8 hours. We had a conversation one morning with the chief nurse, who wanted to create an app at the start of the pandemic for care homes. I think I touched on it earlier. But yeah, gave us a heads up first thing in the morning. By almost close of play, she was emailing all the care home managers, sort of suggesting that this is how we're going to contact you from here on in, or this is a platform we're going to use to share all the resources. Can you share the link with your care home staff? And they were up and running within 8 hours. So it really isn't that complicated to get these things up and running, but it really does give you that ability then to engage with your teams or with your patients or families, using smartphones. So yeah, really simple, and that's how it's been kind of created. Conscious that you haven't got a voice at the moment, so apologies about that. But if anyone's got any questions, if you want to put them on the chat, I'll happily answer those. I've got one question on here from, excuse me, Joa Cruz. How would Piota interact with existing ICS without duplicating features that are developed already within? I'm not sure, into the existing ICS. I've probably mentioned it a few times before, but we're not about reinventing the wheel. So if there are websites that are available, whether other apps that might be available, whether the portals that are available, so things like Patient Knows Best, all those sorts of patient portals, we'll create links to them. Perhaps I'll create a page with a bit of a narrative. What's this all about? How can you use it? What will you get from this? Who to contact, and here's a link to go and access it. So in that context, we're not wanting to reinvent the wheel. We're just wanting to provide the end user with a bit more understanding about what that service is, what the benefits are for them, and a quick and easy link so they can go and kind of go and access it. So yeah, don't know if anyone's got any more questions before I kind of go. That's me, and they're my contact details. We will be back in contact with you. We will send you a kind of thank you for attending this afternoon. There will be a copy of this presentation